I'd really like to thank you all for coming and showing your support for this cause that we at AUPE are going to fight on behalf of the patients and the staff at the Edmonton Hospital. We got a press release, it was one of these typical things where there's no heads up about anything, there's no warning, nothing. All of a sudden a press release comes out saying that they are pulling the money, the funding for the redevelopment of Alberta Hospital. Yeah, for shame. And this, I found out, is the fourth time that this has happened. The money, apparently, the last time was rediverted to the Mazankowski Health Institute. A noble cause in itself, I suppose, but I'm told that there hasn't been one single surgery done there yet. Now, we have a world-class facility in Alberta Hospital out here, and they want to close it down when we know, and I don't want to get into the staffing issues in the healthcare field in the province, because that's a whole other different meeting that I could ask you to come to. But their method is seeming that they come out with this, we'll cut beds first, and then we'll decide what's going to happen to the patients. Yeah, and that is a shame, and we know that every meeting we've gone to, we've met with some of the senior officials, the executive director, and even Dr. Duckett, as much as I can get some of his time, but he is of the opinion that there will be no patients moved out into the community without proper community support. And he's very adamant about that. He has been on as soon as the noon meeting he had out in Fort Saskatchewan, which I attended. He's adamant that we have the facilities, and there's a 3-year plan, 1 to 3 year plan, to move people out into the community. Now, in Mark's introduction, he said that up to 150 beds, and that's what the rumors, that I've heard right off the bat. Then I get a call tonight, and reminding me that the only thing Dr. Duckett has promised is that the forensic part of it is the only one that is guaranteed to stay open. And I'm told that is the 110 beds. So of the 410 that are out there, that means that 300 are going out to the community somewhere. And where we don't know yet, because we do know that the facilities for them aren't there yet. The facility at Alberta Hospital is still a required facility, no matter how many go out into the community. Alberta Hospital provides the best care for acute illnesses, where the doctors and the specially trained staff, and the world-class staff too, can treat and stabilize patients in a controlled environment, which is required for some people that are even out in the community. I'm told that last year there were 1,700 people admitted, 1,100 of them were readmissions, 200 of them were transferred from other Edmonton hospitals. So we know there is a need out there. There's a waiting period of 20 days for beds, and these people are not only from Edmonton, and they're not only from Alberta, but they're from all over Western Canada and Northern Canada too. So this facility is worth fighting for, and that's what AUPE is up here trying to do. In fact, when I say outside patients, apparently about 10 patients, 1 in 10, come from outside the Alberta region. So this is a very regional facility, and it's required to the point where we know that studies have been done. They closed a hospital, the Riverview Hospital in BC. I don't know if anybody's going to speak to that too, but the Premier has even admitted that is a failed experiment. The police department did a study, and it's costing them up to $9 million to gather up these people off the streets, and that's where they're coming from. Now, I don't, need to tell you about what's happened. I mean, almost every tagline these days, you hear of a stabbing out in the streets, and the report on the radio says that, there's some mental health issues with the arrest. Well, that's got to tell you something to begin with, right? So we need the help out there for these people, and even some of them still are slipping through the cracks. So we're trying to impress upon the government that the facility is so important that they have to put the funding back in to this world-class facility. Now, the Premier has said, that infrastructure spending on behalf of the government is what is one of the main drivers of the economy in Alberta today. And he's got a $7.2 billion capital plan expenditure for 2009-2010, and that's only part of the year from $23.2 billion over the next 3 years. But, the spending of that, they're spending $356 million to rebuild and refurbish the old federal building downtown. Now, I can bet you that there won't be one patient from Alberta Hospital going to that building, especially when there's going to be 650 parking stalls with it. So those people aren't going there. So where are they going? That's right. That's what we're being told by the law enforcement and the justice people and the corrections people. The number of people that the RCMP have seen calls with, and they call them emotionally disturbed, have doubled from 2005 to 2008. Now that's an incredible statistic. And the Edmonton Police Crisis Team deals with mentally ill people, have seen a 35% increase in calls since 2005. Mental health advocate Dennis Anderson says judges estimate no less than 40% of the people that appear in court have a mental health problem of some sort. And Corrections Canada reported in 2004 that 12% of prisoners suffered mental illnesses, up from 5% in 1998. Now, Iris Evans did a press conference on the state of the economy the other day, and she said Alberta's not getting smaller. So with those statistics, we know that the people that need help are going to be out there, and those numbers aren't going to get smaller either. And we need Alberta Hospital open. We have a good opportunity to bring members together, and it is about members. Like I say, half the members there, of the 1,400 staff, half of them are members. So we're fighting for their jobs, especially if they close down that facility. Those are the people that AUPE is trying to support initially, but you know what? It's the people of Alberta that AUPE is going to help in this cause. And I thank you for being part of that. Thanks.